Welcome to Learn Medical Spanish. Today I'll be going over a general HPI for any patient with some type of pain as their chief complaint. So a history of the present illness as long as it's some type of pain, like abdominal pain, chest pain, a headache, foot pain, whatever. If it's something besides pain, it might not work quite as well, but you get the idea. So quick reminder, I've got some very focused beginner lessons that I created for providers in particular, and I can email those to you if you go to learnmedicalspanish.org/lessons. So there's a really high yield, especially for providers. I'll put a link below as well. Okay, so let's go ahead and get into the phrases. So here's the first one. Where exactly does it hurt? So think about that translation. ¿Dónde le duele exactamente? ¿Dónde le duele exactamente? Point with one finger. Señale con un dedo. Señale con un dedo. And if you're looking at the text right now, as I've said in the past, if it's in parentheses, if part of the phrase is in parentheses, that means you could probably leave it out and still get the point across. So you'll see that from time to time. How many days, as in how many days have they had this pain? ¿Cuántos días? ¿Cuántos días? Hours, as in how many hours. Horas. Horas. Minutes. Minutos. Minutos. So in other words, you can say how many days, how many hours, how many minutes, or you could even say how many weeks or how many years, like cuántas semanas, cuántos años. So you just replace that word with whatever you want it to be, depending on the suspected time course. Is it worse now? As in, is the pain worse now than when it first started or something? Is it worse now? ¿Está peor ahora? ¿Está peor ahora? Better now? ¿Mejor ahora? ¿Mejor ahora? Still the same? And this won't be a literal translation on this one. It'll be more like it continues to be the same, but still the same? Sigue igual. Sigue igual. Is it sharp? Es agudo. Es agudo. Pressure-like. Como presión. Como presión. Burning. Ardor. Ardor. Just pain. Solo dolor. Solo dolor. The reason that last phrase is in there because there's not necessarily a word for like aching in Spanish. So just the actual word pain kind of means a certain type of pain in a sense, which could be kind of like achiness or just kind of, if you imagine just a general type of pain that's not necessarily sharp and stabbing, but it's just kind of painful. So achiness might be the best translation for that, and that's what we're getting at with that last phrase. Is it severe? This will sound more like, is it strong? But we're asking, is it severe? Es fuerte. Es fuerte. Mild. Leve. Leve. Moderate. Moderado. Moderado. Is it all the time? As in other words, does it hurt all the time? But is it all the time? Es todo el tiempo. Es todo el tiempo. Does it come and go? Va y viene. Va y viene. How many minutes does it last each time? ¿Cuántos minutos dura cada vez? ¿Cuántos minutos dura cada vez? Do you feel worse when you se siente peor cuando se siente peor cuando walk, when you walk, in other words? Camina. Camina. Eat. Come. Come. Cough. Tose. Tose. And of course, this list would vary a lot depending on what the chief complaint is. When you say, is it worse when you blank, blank, blank? These are just kind of some general ones that come up a lot, but you'd have to insert whatever situation you want to add there. Like, is it worse when you squeeze with your hand, or who knows? Do you feel better when you? And so this will be the same way. I'll use a few examples, but you might have to just add your own phrase here. Do you feel better when you? Se siente mejor cuando. Se siente mejor cuando. Rest, when you rest, in other words. Descansa. Descansa. Take medicine. Toma medicina. Toma medicina. Have you felt pain like this before? ¿Has sentido un dolor como este antes? ¿Has sentido un dolor como este antes? Does the pain radiate to other places? ¿Se le mueve el dolor a otros lugares? ¿Se le mueve el dolor a otros lugares? Point to where. Señale dónde. Señale dónde. So again, quick reminder, you can get my focused beginner Spanish lessons at learnmedicalspanish.org/lessons. Super high yield, especially for providers. And if you're on YouTube, you can see there's a playlist there with other emergency medicine related dialogues and other info, other videos, and then a video with some information about my CME course and some other links below. Thanks for watching or listening, and I'll see you next time on Learn Medical Spanish.